Hello everybody, my name is Paul Haidet. I'm new here to YouTube webcam. Very exciting, so thank you very much. I'm happy to be here. I'm a registered nurse of 6 years from Miami, Florida. I work on a medical surgical telemetry floor. I love nursing with all my heart. I feel it's a wonderful profession because we provide excellent patient care. We make sure our patients convalesce, they get the most optimal health possible. And it's wonderful to see our patients smile and knowing that we're doing everything we can to bring them back to health. So it's very rewarding indeed. Nursing is a very relatively new profession, and from the Middle Ages. And at first, nursing was considered a very lowly profession. Only prostitutes and people in prison would take care of the sick and needy and the impoverished. So from this time, well, later down the road, a nurse Florence Nightingale, famous nurse. She's also known as Lady of the Lamp. She was in the Crimean War in 1854, and she would go into battlefields and she would take care of the dying soldiers. And she would notice that there would be an increased mortality rate from these soldiers. Their wounds would get infected and they would die quick. And she incorporated cleanliness into the wounds, taking care of the soldiers, and over time she noticed that due to the cleanliness, the mortality rates have gone down significantly. So that was very important to know. She also published a book, Notes of Nursing, What It Is and What It Isn't, and it deals with different nursing themes, such as the environment, the patient's environment, such as light, water, cleanliness, patient variety. If a patient is stuck in the room all day, it was encouraged that the patient get out and get some fresh air. It would be good for the patient. It would help alleviate depression. The patient will feel better. So it's simple things like these that Nurse Nightingale put in her book. I haven't read the book, but I heard it's very good. And as a result of her meticulous studies and her observations, many nursing schools were opened up in England and also the United States, and many nurses have followed suit in her path. And there's been an increase in technology and also in patient care. And throughout the years, mortality rates have continued to gone down significantly, and patient care has definitely improved. There's many different nursing programs out there through the military, the civilian world as well. You can be a registered nurse, you can be a licensed practical nurse of 1 year. Associate is a 2-year program. A diploma is a 3-year program. And also a bachelor is a 4-year program study. I am a 4-year bachelor nursing and nurse. I graduated in Kent State University 2001. I also went to Wright State down in Dayton in the years prior. So there's a lot of diversity in nursing. I feel that nursing is a very rewarding profession. It's a very trusted profession. Many people respect nurses for their expertise, for their professionalism, and the great care they give their patients. So this is very important. There's currently a major nursing shortage in the United States, and this is due to the lack of nursing facilities to accommodate the students, and also nursing educators, nursing faculties retiring from the profession. It's very unfortunate indeed. I feel that the government should give more money so we can build new nursing centers, and also to teach our nurses to become nursing educators, so we can prepare our future nursing students for the future and take care of the sick and the vulnerable populations. I think that we will make some progress in the future. Change is slow, but we are making some progress. We do have different nursing chapters. We have an organization, the American Nursing Association, and other different nursing chapters as well through organizations. I feel that anybody can be a nurse as long as they're caring, compassionate. They like to solve problems. They use critical thinking skills. They love to incorporate art and science as well in nursing to help care for the patient. Male nurses are greatly underestimated in the nursing population. They represent only 5% or 2 million male nurses of the nursing population. So we are getting more male nurses in the profession. It is a little bit slow, but we are making great stride. A lot of what really upsets me is that a lot of people make generalizations about male nurses. They're saying that they don't belong in as a nurse in they're not fit to be a male nurse, that they're effeminate if they're in the nursing profession, or they're gay, and they should be doctors instead. I've heard a lot of comments from people, and it just disheartens me. It makes me upset, and I choose not to listen to this. I try to educate people that nursing is different from medicine, that nursing is dealing with treating signs and symptoms, and medicine, you're treating the disease process. So, and a lot of times people are understanding of this, but we can blame the media for portraying nursing as a female profession. There's been very little support for male nurses, but I think there's change that's coming around. I'm not against female nurses. I get along great with female nurses, but I feel we should also have a lot more male nurses and counterparts, because male nurses provide excellent care just as good as the female nurses do. So, I say, what's the big deal? But we shouldn't listen to people's negative stereotypes and that. So I think there's changes being made, positive changes. It just takes time. But if you believe in yourself and you're very compassionate and you love helping people, then nursing is the right profession for you. There are scholarships available to help. There's mentorship programs. There's counselors that can help, guide you, give you information about being a nurse. Also, there's different websites you can go to. There's also famous commercials such as Johnson & Johnson about being a nurse. It's very rewarding. Nurses, as I said, are very trusting. It's a very trusted profession, very professional, and very charismatic, very caring. So there's a lot of different good qualities to nursing. I would like to talk in future YouTube segments about what I do as a nurse in my days that I work, how I solve problems, what to look for, give you different tips to nursing. Like I said, I think that, nurses have a lot to offer, and, we have our good and our bad days. And for me, I don't let the bad days get to me. I, do the best I can, and I go home with a smile on my face knowing that I did everything I could to help my patients. And we utilize a lot of teamwork in our patient care. We help our nursing assistants to bathe the patients, get them out of bed. We help feed. We also take vital signs as well. It's just not a nursing assistant's responsibility. It's also the nurse's responsibility, but we take great pride in what we do. And I feel we've been very respected among the medical professions. And I'm also working towards a master's in nurse practitioner. I'm doing that part-time, one class every semester, and I get reimbursed through work, and that's very nice. But after I get my master's in nurse practitioner, I would like to go on to work in a PhD program so I can be a nurse educator, preferably in a university setting. And knowledge is power, and it's how you choose that knowledge. It can open up many doors for you. It looks good on a resume. I've been a nurse preceptor. I've trained many nursing students on my floor. I've showed them the ropes. I showed them what to look for, how to use critical thinking skills, have to have confidence in themselves. So, because nurses coming onto the floor for the first time, it's a very overwhelming experience. There's a lot of information to deal with, and it doesn't come overnight. You need some time to learn that information. My orientation took me 3 months, and I had great training. And my confidence level has gone up significantly. So I'm very happy with that. I'm very happy with my preceptor for training me too. I received numerous awards. I received Nurse of the Month and Nurse of the Year. Nurse of the Month I got for saving a patient's life. She was having a seizure due to medication, and I called a code blue. We got in and we rescued her. And I got Nurse of the Year, for being a well-rounded nurse, for maturity, for growth, for learning, and getting a lot of good compliments from family members and also patients themselves. So it's a very humbling experience. And I'm also critically care certified, and I have ventilator training and also wound care training as well. You can really build up your resume in a short amount of time. But every day I go into work, I learn something new, whether it's new medication